Conference will now be recorded.
All right, so these are the agenda items for today's meeting. So we'll start out with brief information on the Southeast chapter, followed by the executive board member introduction. And then our secretary, Ashley, will talk about events highlighting 2025, followed by our treasurer, Nick's annual treasurer report. And then after that, we'll have our committee chair introduction and status updates. And then Vivian, our incoming president, will present our plans for 2026. And then lastly, we'll open up the floor for any discussions and questions. So we start every meeting by stating the chapter mission and vision. So the mission is to secure the highest quality care for all critically ill and injured patients in the Southeast region by providing educational and research opportunities, as well as promoting multi-professional collaboration. Our vision is that all critically ill and injured persons in the Southeast region will receive care from a present, integrated team of dedicated trained intensivists and critical care specialists, as well as inspire new leaders and providers of critical care in the region. The Southeast chapter is proud to represent 7 states. We are one of the largest chapters of SCCM, and we are proud to be a multi-professional organization with physicians, nurses, pharmacists, RTs, APPs, and other healthcare professionals being our members. Our goal is to encourage SCCM membership and to provide education and networking opportunities for our members. So some benefits of being our SCCM member, Southeast chapter members are listed here on the slide. So you'll have access to our quarterly educational meetings, which are often hosted by national level speakers, and Cs are usually provided. You'll also have access to our triannual chapter newsletters. You can gain mentorship and networking opportunities through our virtual and in-person events. And we also offer community outreach events as well as leadership experiences. If you want to learn more about our chapter membership benefits, or if you have any questions, you can visit our website at www.sccmsc.org/membership. Next, I would like to mention our chapter exec board members who have served you the last 2 years. So I gotta skip this slide. I would like to thank everybody on here for their contributions to the chapter the last 2 years. And I'm happy to say that after our chapter elections, most of the executive members are staying, either in their current role or different capacities. So in the next slide, I would like to introduce you to our new chapter executive members. Sorry, I'm trying to move this slide. Here it is. So these are your executive board members who will be serving the next 2 years. So I'll have them all introduce themselves to you, starting with Vivian.
Hey everyone, I'm really excited to step into the role. I've been involved with the chapter for many years. I'm Vivian Liao. I'm the incoming president, currently the president-elect, and IHAN has done a wonderful job the last 2 years in leading us with the chapter in a very healthy place, as you'll see in the rest of the report. And I'm currently a clinical assistant professor at Mercer University. And again, I've been involved with the chapter for many years, serving in various roles, and I'm excited to take lead on this in the next 2 years, and I look forward to working with everyone. Thank you. And I'll turn it over to Nick, who is our president-elect.
Hey everybody, my name is Nick Barker. I'm the System Assistant Director for Clinical Pharmacy Services within Emory Healthcare. Prior to wearing that hat, I was a CVICU pharmacist. I've actually been involved with our chapter, I think, since I was a 4th-year student, probably back in 2014. And then as a resident, took on some various roles on different committees, helped with coordinating different meetings that we had and educational programming. I've done our bite-sized lecture series for a few years. And this past few years, I've been our treasurer. I'm happy to say that you'll kind of see our financial report here in a few minutes, that we're in good standing. And excited to hand that over to Ashley as I take on this new role with Vivian, and appreciative of Yen for everything that she's done over the past few years, and excited for what we're able to do in the near future. I will pass it to Ashley.
Hey everyone, my name is Ashley Taylor. I'm a clinical pharmacist at Wellstar MCG Health in Augusta, Georgia, and work in the surgical and cardiothoracic intensive care unit. I've been involved in the chapter for several years now. I started on the membership committee and did that for a few years, and then transitioned into my current role, which is secretary for the chapter. So I've done that for 2 years and really excited to get involved as treasurer this upcoming term. So super excited to be involved. Kyle, handing it off to you.
Good afternoon, everyone. My name is Kyle Brown. I am a critical care pharmacist at Piedmont, Atlanta. I practice in one of the cardiovascular units here. I actually relocated from Florida 3 years ago, and ever since I've been involved with the Southeast chapter of SCCM, but I've been a member of SCCM since 2018, as well as an active member in the CPD section. This past 2 years, I have served as a bite-sized lecture coordinator, and looking forward to getting more involved with the executive board this year.
Thank you so much, Kyle. Dr. Mann, would you like to introduce yourself?
Sure. I'm Shana Mann. I'm a physician over at Wellstar MCG. I work in both the CVICU and MICU. I was a member at large last year and excited again to be helpful and contributory this year. Yeah, looking forward to it.
Thank you so much, Dr. Mann. I don't think Dr. Ravi is on the call, but she is the other member at large who was newly elected this year, and she is an assistant professor at Emory University. So we would like to welcome her. So the transition will happen officially after the Congress later this month. So please welcome our new executive board members, and please feel free to reach out to them if you have any questions about the chapters. I'm confident that they will continue to do a great job in serving you the next 2 years. So in the next few slides, our secretary, Ashley, will talk about our achievements in 2025.
So the next couple of slides, we're going to go over some of our highlights from 2025. In 2025, we were very pleased to offer educational lectures on a variety of topics with speakers of different disciplines. We had 4 quarterly educational meetings. Some of these we were able to offer continuing education credit for, so we are very excited about that. Our March educational topic was on the management of pulmonary arterial hypertension. In June, Dr. Philip Yang provided updates on the 2024 SCCM corticosteroid guidelines. In August, we were excited to host SCCM President Dr. Pascal, who discussed the management of traumatic brain injury in the intensive care unit. In November, we collaborated with Gaspin, where Drs. Miller and McClave discussed shifting paradigms in critical care nutrition. We also had a variety in our bite-sized lecture topics, including vasoplegia and refractory vasodilatory shock, OB emergencies, management of cardiogenic shock, and anticoagulation considerations in trauma. Our guest speakers came from a variety of backgrounds, including physicians, advanced practice providers, pharmacists, nurses, and more. In May, we were very happy to host our first ever educational course on continuous renal replacement therapy. This course discussed essential CRRT topics, including the nuances of CRRT modalities, timing and indications of CRRT, medication considerations, and more. We are happy to host 19 participants to this course, and we want to extend a big thank you to everyone who helped make this course possible and really successful. May was a very busy month for us in 2025. We also hosted our Turn Your ICU Blue Day in honor of National Critical Care Awareness and Recognition Month. On May 16th, ICU staff wore blue to show their support from 12 institutions throughout the region. We were able to provide refreshments for participating hospitals, and we have some pictures of that event located on the screen. In September was Sepsis Awareness Month, and so we were very proud to host our second annual Stomp Out Sepsis 5K. This was a new event that we started in 2024, and we are very excited to build on our success from 2024. We worked alongside Karen Theakin, a sepsis survivor, and Rob Goldsmith, the executive director of fundraisers, and had 50 individuals come out to participate in our 5K, and we were able to raise $2,500 for the Sepsis Alliance. And we want to say a big thank you to all of our sponsors and volunteers for this event who helped make the day so successful. And that is our year in review.
Thank you so much for that, Ashley. Next, we'll have our treasurer, Nick, present his treasurer report.
Hey, everybody. Thank you. So kind of as I alluded to earlier, we did very well this past year. In 2025, we ended with a little more than 1,000 less in our accounts than we had the previous year. However, we are still very stable with our funds. And I think a part of that is just wanting to highlight where we invested you, our chapter members, over this past year. So Ashley did a great job of bringing up a lot of those things, and you'll see a lot more of that. So I don't want to take away from a lot of what's going to be presented on, but just want to remind people that we've increased our activities, different participations. So Stomp Out Sepsis, different donations that we may make to those funds. We've also increased the number of awards that we are giving out to our members. And then also the course offerings that we provide and people being eligible to go for those. And then the continuing education costs that come up all the time. And then just wanted to remind everybody that membership registration is very easy. You do it along with your SCCM registration. And so part of that is just making sure that we have you guys listed. It accounts for everything, and so that we can offer these different services to you like we did this year with the different events, ICU Blue Day, etc. So thank you all.
All right, thank you so much for that, Nick. All right, so for the next few slides, we'll have our committee updates. So as you can see on the slide, we have various different committees serving our chapter, and our committee chairs are working hard behind the scenes to make the chapter activities available to you. They have been serving the last 2 years, and most of them will continue to serve the next 2 years. And I really appreciate all the committee chairs' effort and hard work. So for the next few slides, I'll have them introduce themselves and give us updates on what they're working on. So first, we have a membership committee. So Kristen and Lindsay, would you like to take the slides?
Yes, thank you for the introduction. My name is Kristen Livers. I'm a critical care pharmacy specialist, specifically in trauma and surgical ICU here at the University of Louisville Hospital.
And I'm Lindsay Whitecamp, and I am the clinical specialist in the neuro ICU here at U of L.
And you can go to the next slide. Okay. Some of the main responsibilities that we have with the membership committee, first of all, we maintain the chapter membership database. So we just went through and did a large cleanup of our listserv just to make sure that everyone is still active, is in our listserv and getting all the updates. We also will be sending out lapsing membership reminders for anyone who was removed from our recent cleanup. We also help with membership recruitment. We look forward to seeing anyone who's going to be at the SCCM Annual Congress later this month. Membership recognition as well. And then every year we do 2 surveys to collect feedback from members of our chapter as well.
Perfect. Thank you so much, Kristen. Thank you, Kristen and Lindsay. I think you're planning on sending the next survey after the Congress. Is that correct?
That is correct. We're putting the final touches on our membership survey. If any of the other committees have any questions that they would like added to the survey, just let me know and I'll get those added in.
Yes. All right. Thank you so much. Next, we have Education Committee on the slide. I'm not sure if either of them were able to join. Trin and Brandon, are you on the call? Okay. I don't think they're able to make it, but Trin is a pharmacist at Emory, Maine, and Brandon Frady is an NP at Northside Hospital, and they are our education committee chairs. Their main job roles are to process CE for the quarterly meetings, as well as our chapter courses, and they're also heavily involved in organizing our educational courses. So these are your CRT or ultrasound course, and sometimes we offer FCCM course. Next one we're working on that we can potentially offer to you is the ICU Liberation course. So please be on the lookout for any more information on that. Next, we have Programming Committee.
Hold on, Ayhan, I think Trin just joined. I just want to give Trin an opportunity if you wanted to have any updates about the education committee that Ayhan didn't provide already.
Yeah, perfect. Sorry, Trin. Do you have anything you would like to add?
No, sorry. I joined in a little bit late, but no major updates. We're still working on our CE process for the pharmacists for these upcoming courses since we had to change the vendor last minute. But potentially this upcoming year, we will try really hard to push out the ICU Liberation course and then CRT if it worked out with Dr. Connor's schedule.
Okay, perfect. Thank you so much for that, Trin. Next, we have Programming Committee. Is there anybody on the committee on the call? Okay.
Neha was on. Maybe she hopped off.
Okay. So brief update from their end. So they're working on Rita and Emily and Neha. They are the committee chairs for the programming committee. They're the ones that are organizing the quarterly lectures. So for 2026, we recently had a CRT topic presented in February. And in June, the upcoming presentation is on HEMONC emergencies in the ICU. So please mark your calendar. June 4th is the date. And then we're planning on hosting our national SCCM president, Dr. Chang, give us a presentation in August. We're still working on that. And then November, our potential topics are either opioid use disorder or AI in med education or potential nutrition. So if you have any specific topics that you would like us to cover, please let us know. So Outreach Committee, I believe Tia is on the call. Tia, do you have any updates? Would you like to introduce yourself?
Yeah. Hi, everyone. My name is Tia Collier. I am the medical ICU and neuro ICU pharmacist at Erlanger in Chattanooga, Tennessee. I am newer to this role for the outreach committee as I took over from my counterpart when she vacated. And so last year we were able to have our National Critical Care Awareness and Recognition Month, where we turned the ICU blue and we're able to provide different refreshments and different goodies to multiple different ICU and to different institutions. And something that I would like to start in the new year is highlighting some critical care staff in our chapter and our accomplishments and all of the different resources that we're providing to try to increase our outreach as a committee as a whole. And then we also in November are responsible for providing those leadership gifts.
Okay, perfect. Thank you so much, Tia. I think that's a great idea to start doing the membership highlight. And also Tia will be present at the Congress this year, and she will bring some goodies for our chapter. So please, if you're planning on attending our Congress, please come by and meet Tia in person.
Absolutely. Yes, we'll have some pens and some chapstick for everyone.
Yeah. Thank you so much, Tia. Part of outreach committees is also organizing the sepsis awareness event, and Sam is the committee chair for that. Sam, are you on the call?
Yeah. Hi everyone. I'm Sam Punajan. I'm from Grady Hospital Neuro ICU. So for those of you not familiar with our 5K run, so I'm part of the committee for the past 2 years, and we were able to start this 5K run since 2 years ago. Part of this, we started it without any sponsor, and then we tried to establish everything from scratch by working to getting the permissions from the city, and then making sure we have different teams helping us so to have this 5K run running. It started 2 years ago. Everything went good. We had a little bit of a donation on the first year. Last year, we're able to extend it. We have a little more sponsorships and involvement from the other hospitals, so that turns out to be a bigger donation on behalf of the chapter to the sepsis awareness. And then from that last year to this year, we already started the planning for more sponsorships and establishing to keeping this routine of the 5K run. And we were able to already have one sponsor joining us that is helping us for the donations of the breakfast, and also more donation down the lines, working with the chapter for this sepsis awareness, and also to be part of our chapter in general for other future educations, and as much as they can. So far, especially thanks to Van to connect us to this sponsor. So we already have one sponsor. We already have the date set up to be on September. We're going to send more information. But if you have down the line, if you have more connections to any companies or anyone that you know, specific vendors that you know they're going to be involved, they like to be involved as much as they want to donate, they're welcome to donate and be part of the chapter, have a table, and be part of our team. So if you have anyone in mind, always welcome to email me and text me, and I definitely set up a meeting with them. So far, we met with 4 of them. 2 of them will be probably part of this year's sponsorship. And then the goal is in the next 2 years, other than continuing this 5K run, we also reintroduce back the volleyball tournament, which was really fun, and then it's more like a team gathering from your institution. If you like to be involved, definitely give me feedback. So far, the feedback was the good thing about the 5K run is everyone individually can participate. We don't need a team. But for the volleyball, also is a good family times and also good gathering from the hospital. So if you have any feedbacks or any other event you have in mind that definitely can help, let me know.
Thank you so much for that, Sam. Yeah, the sepsis 5K the last 2 years have been a great success, and if we can bring back the Spike Out Sepsis again, that'll be another amazing event. And this is one of these two events are going to be our biggest in-person gathering for our local chapter. So if you're free on Saturday, September 24th, please plan on coming out and joining us. Thank you so much. Next, we have bite-sized lecture. Kyle, would you like to talk about your lectures?
Sure. Hey, everybody. Kyle Brown again. So thank you, Ashley, for covering the past presentations. But my role as bite-sized lecturers to highlight clinicians around the region, to have them present on their experiences and knowledge in certain disease topics. Currently for 2026, we're looking to do a toxicology or emergency medicine topic. Pediatrics is a big one that we're hoping to highlight this year as well. And then point of care ultrasound and resuscitation is also in the works. More information is pending once we have all of our speakers ready and their schedules cleared up. So please be on the lookout for any of those updates, as well as please feel free to reach out to me or the executive board as far as possible topics going forward, or even if you are interested in providing a bite-sized lecture. For those who may not be aware, the bite-sized lecture is what it sounds like, a short lecture designed 3 to 4 presenters to highlight a 10 to 12-minute topic from their discipline. So this is an interdisciplinary talk to allow for our attendees to learn a little bit about this disease state so they have an understanding, but also is able to motivate and encourage further education and looking up on their own time as well. But yes, please feel free to reach out to me if you guys have any other questions, comments, or concerns, as well as suggestions. Thank you.
Thank you, Kyle. All right, next we have social media committee.
I can start. My name is Joanna. I'm a medical surgical critical care pharmacist at Austin LSU in Louisiana. I help to update our Facebook and our Instagram social media sites. So if that's your preferred method for getting news on the chapter, give us a follow on those 2 platforms.
And then my name is Peter Moran. I am a neurocritical care pharmacist over at University of Kentucky Healthcare in Lexington, Kentucky. and I am in charge of helping with the actual SCCM website that we utilize. That's listed second from the bottom there, as well as posting on SCCM Connect. So if you guys ever have any questions, feel free to reach out.
Thank you so much, Joanna and Peter. And if you guys aren't already following our social media platforms, please, whenever you can, please follow us. Our handles are listed on the slide. All right, next, part of the social media committee is the formerly called Twitter or X Journal Club, and Josh is responsible for hosting the journal clubs. So I'll have him speak on that.
Yes, so this is something that's been in the works, and we're happy to get it off the ground in April. We wanted to shift our platform for hosting these discussions from X to Blue Sky. Blue Sky is much more of a place for academic discourse, and so we encourage all, if you've not already, to discover Blue Sky, create a profile, find us in April, and that's where we will have our first discussion on current implications of DEXA-ARDS and really just corticosteroids in the context of ARDS and the new information that's come out.
Thank you, Josh. And Josh is also responsible for being the chair of our newest committee, which is the awards committee. So he'll talk about that.
And so, yeah, we've gone through the cycle. We appreciate all who either self-nominated or submitted a nomination for somebody else. There's tremendous talent in our chapter, and there was two goals we had in expanding awards we offered. One was chapter member recognition, and another is just encouraging participation in SCCM, the organization as a whole, even beyond the chapter. That includes attendance at Congress. And so one way to encourage that is to offer professional development awards, which we did to allow a scholarship opportunity for those who desired to attend the Congress and represent our chapter. We also are able to offer awards related to various areas that SCCM encourages ultimately on the road to achieving FCCM status. And so we're proud to be able to offer that opportunity. And we have awardees selected, and we are excited to be able to announce that during our chapter reception in Chicago this year.
Yeah, thank you so much, Josh, for organizing those awards. So like Josh said, we'll be announcing the winners shortly. If you won the award, we'll send an email before the Congress so you're aware. And if you received either professional development award, you're required to attend the Congress as well as the reception. So more information to come on that. But we'll continue to provide these awards next year. Hopefully we can make this like an annual thing. So thank you so much for everybody who applied. Next, we have Communication Committee. I believe Van said that she is not able to attend. So her main roles are to update our critical care connections, as well as to update the quarterly lecture slide decks. And she also publishes our triennial newsletters. And the most recent one was published last month, and she'll have some copies available at the Congress. So if you have anything that you would like to see announced on our chapter newsletter, please reach out to her. All right, so that is it for the committee updates. So thank you, everybody. Next, we'll have our incoming president, Vivian, talk more about Congress information and other chapter announcements.
Great, thank you so much. So Congress is coming up very shortly in the next couple of weeks. And if you're attending, we would welcome and really want everyone from the chapter to come to our reception that is scheduled for Sunday, March 22nd from 6 o'clock to 7:30 p.m. Central Time. And it's going to be in the calculus room at the Marriott. And if you can't remember that, we will be advertising and it'll be posted in the general SCCM program. And so you can go ahead and mark your calendar. And it is a time where we meet each other in person and having worked together, but also welcome new members. So it's just a place to get away from the larger meeting and to be able to meet and see each other. So hope to see you there. I also am pleased to announce that this year we will be recognized at the Congress because we won the Chapters Alliance Excellence Award. And so this chapter award is a prestigious award. It recognizes one chapter a year for the work that it's doing. And we have done a lot based on the report that Anhyun gave in the committee updates. And so we were recognized for providing mentorship, holding regular meeting activities, and just continue to provide outcomes and measurements to report the things that we're doing, as well as professional growth that benefits the members of our chapter. So if you're already going to be there, and we will be recognized on Monday, this day after the reception. And so it'll be March 23rd at 3 to 4 p.m. Central Time, and it'll be at the Skyline Ballroom. And again, it'll be posted in the general programming. So please celebrate. A lot of y'all have done a lot to contribute and to help out. So this is also a testament to everybody's hard work. So please help us to celebrate our chapter together. I also am pleased to announce that another one of our travel award recipients this year, we have 3, and the people who receive the leadership travel awards have been very active in the chapter. You've heard from them, you've seen them, and I'm pleased to announce that Nick Barker, Ashley Taylor, and Kyle Brown are the recipients of the leadership travel awards, and they will be transitioning out of their current roles and into the executive committee, as you all have already seen. So congratulations and thank you for your contributions. I also want to announce that every year we have the Barbara McLean Nursing Excellence Awards, and so this will be open. The call will be open around May, so please be on the lookout. So if you have worked with some excellent nurses and those who want to be recognized, please think about who you want to recognize. Again, this is a time for us to recognize excellence. And we will continue to offer opportunities for reimbursements or grants for our educational courses and other activities. So again, continue to stay tuned through our newsletter so that you can be on the lookout for other opportunities that come up. And last but not least, although we have excellent leadership and people who contribute to our chapter, we still welcome help because our chapter is large and it covers various states, and we want to be comprehensive and cover every profession. So there are opportunities for non-elected positions to serve in project lead roles or committee chairs, or just to be on a committee. We are looking for help to continue our Blue Sky Journal Club, also our bite-sized lecture series, and as well as helping with communications committee. So if you are knowing, or if you know somebody, or if you're interested in serving this capacity, please let us know. And again, this is a great time for people who may be nervous about being involved outside of their normal professional duties. So these are a great way to just get your feet wet and help a larger regional role. And then finally, I want to thank everyone for being in our chapter. I know, again, this is above and beyond normal duties, and so it's really meaningful to us. And I think, again, a testament of our hard work is our recognition this year at the chapter to be the Excellence Award. And I also want to mention that this is our 3rd time winning the Chapter Alliance Award, so I think we have a great track record. And so again, this is a testament to everyone's hard work. If you have questions or feedback, please contact us at communications@sccmsc.org and continue to follow us on our social media handle and the various names right there. And again, I want to take this time once again to thank Ahyan Jun for her wonderful leadership over the last 2 years. There are many moving parts and covering multiple time zones as well as different states. And so I think being organized and having a central person to keep everyone on track was very important. So again, thank you for her leadership, and I continue to look forward to work with everyone in the upcoming 2 years. And if you have any discussions or questions, I want to open the floor up if anyone has questions about what's been presented or any questions. I don't see anything in the chat. Okay, well, if there are no questions, again, feel free to email us or reach out to us directly, and we will continue to be in touch, and we'll hope to see everyone at Congress.